Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. Your tip for today is going to come from my friend Bill Light. I recently had the opportunity to sit through his CPEN review, and I got to tell you, it was fantastic. If you ever get a chance to see it, it's definitely worth your time. Today, Bill's got a little tip for us. If you've ever used topical anesthetic called LET, is a great tip for LET. Enjoy.
My name is Bill Light, and here's a tip to being a badass nurse. If you've ever applied LET or LAT or any of the other acronyms for it, but topical lidocaine that you might put into a laceration, one that will close on its own at rest. So you can put a mixture of lidocaine, atropine, and tetracaine. Or some combination like that. So oftentimes people will put it like you'll put a cotton ball and then just open the wound and set it on top of it and then tape it down. That can work, but a doc taught me this. Not just me, taught all of us, all the staff this years ago, and it is the most amazing way to apply LET, whatever. Now TAC is another version, and I can't promise you this works exactly the same. So if it's a LET or LAT version, this is the way I've used this one. Okay, so you take that same mixture. Usually comes, pharmacy makes ours, right? Comes in that little bottle or whatever, a little cup. You pour that into a med cup. So you have a little med cup with whatever the 10 cc's or whatever of your LET solution. And then you take a cotton ball, same basic idea, but you just pull off the edge of it. So maybe you have a 1/10 of the cotton ball, just a small torn off piece of the cotton ball. And then you drop that into your med cup and into your solution so it absorbs it. But you just have a small bit of it. Now you take your sterile cotton-tipped applicators, and that's what to say Q-tip, I guess, because that's a name brand or whatever. But your sterile wooden applicators, right? Then you get the kid all ready, you lay them down, blah blah blah. Now we always did it, we'd use the little magic wand thing, give the kid only one of those Q-tips, those applicators, right? Give him one, you make it a magic wand game or whatever. So you take the Q-tip. I'm going to call them Q-tips because that's easier for me to say. The wands, right? So you take it and you actually flip it around though. You use the wooden end of it. So it's sterile, right? So don't touch it to things. So then you dip in the wooden tip of it, dip it into your cup of fluid of LET solution, and you fish out that now soaked piece of cotton, and let it stop dripping or whatever. And now it's usually blue because one of the things, I think maybe the tetracaine, something in there usually has a blue color to it. And you take that, and it's cold because it's been in the fridge, right? And you let the kid know it's going to be a little cool. And then you just sort of open the wound just a little bit, let it gape open just a little bit, and you lay that cotton, that piece of the cotton ball, lay that soaked cotton right in the wound, right along the wound bed, and then you embed it underneath the wound, inside the wound. Take the tip or the edge of the wooden stick and just press it lightly right inside the wound. So now you're kind of packing inside that wound margin with this lidocaine, not atropine, that's not the word, adrenaline or epi, and tetracaine. You put that medicated cotton inside the wound bed. Now, if you got too little of cotton, then you just tear off a little more, put it in the fluid and absorb more, right? And then you just keep packing until you have more in there. So you just embed enough cotton in there so it fits. Now, generally, if you get a little too much cotton, it's not a big deal because usually you can pack enough in there to get it to fit. But you pack it all in there and just kind of press gently so it goes inside the wound. Once it's inside the wound, take take a tegaderm, opsite, whatever you want to call them, but generally it's tegaderm, like from a start kit, from an IV start kit. Most of our hospitals will buy just extras of those. So just a standard size. Take a standard size tegaderm, and then you just place it right over, let the wound kind of close up, but it doesn't have to be completely closed. That's fine. And then you just place that over the top. Important that it's transparent so you can see, but place it over the top. So now you have the wound with the medicated cotton inside of it, and then you place the tegaderm over the top. So because there's a vasoconstrictor medication inside, that's why it's has the tetracaine and epi, or you have your whatever the other version was. I can't remember what the other one was that I said, but that's the important thing, is there's a vasoconstrictor involved. So now that you can see it with the tegaderm, you can watch it, let it set for, generally we let it set for up to 20 minutes, and you can tell it's numbing, it's doing its job, because you'll see a border of blanched tissue as it's vasoconstricting. You'll watch that expand out, and you can see where the numbing is occurring. And that's why the tegaderm is important, because now watch it, and you'll watch it blanch out away from the margins of the laceration, and you know where it's numbed. Completely passive way to numb the wound, and it works great. But if you just put the cotton ball on top of the wound, which is the standard way to do it, it never actually gets underneath the skin, and it never numbs it. So that's why a lot of people are like, oh yeah, lead doesn't work. It barely numbs anything, because it's true. The skin itself generally blocks absorption of that fluid, at least according to this doc that Joe Canoyer, if you care, but he's a great doc. But he would say that it wasn't effective that way. You had to get it underneath the wound. It's exactly how we numb it. We're breaking the skin's barrier to push that fluid underneath the skin. So that's all you're doing, is you're just delivering it under the skin that way. And then what you do when you go in to clean it, you'll just reach, or the provider will do it. They'll just take their tweezers and they'll just pull that cotton right back out after it's numbed. So that's my little tip. Now, do make sure that you follow protocols. Make sure you're allowed to do that. So make sure that your Nurse Practice Act lets you, and or your hospital policy lets you. But as long as you're allowed to do that, I'm not sure why you wouldn't be able to. But in case, just make sure you're allowed. And if you can, it's a great way to numb the wound passively, and it usually does an amazing job. If you can get that seated under there, generally the kid, in my experience, we rarely ever need to do any needle numbing on these kids. So it's a tip. Hope you like it.
Well, that's it. That's your tip for today. I hope you enjoyed. Don't forget to leave a rating and review for this episode, and definitely share it with a friend. We appreciate your help in getting the word out about this podcast. That's all we have for you today. Have a great shift.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.